Welcome to Physician Heal Thyself, the podcast, empowering you to take a whole person approach to your well-being, spirit, soul, and body. Join me, your host, Dr. Ana Lara, naturopathic doctor, entrepreneur, and a servant of Jesus Christ. We are not just a body, we are spirit and soul. It's time to integrate medicine and spirituality into our healing. Let's get started. Welcome back to Physician Heal Thyself, the podcast. I'm your host, Dr. Ana Lara. This episode, we're going to dedicate to talking about the gut-brain connection and what your doctor won't tell you. So, it's not uncommon that I get a lot of patients in my clinic with gut issues or mental health issues. So we're combining these topics together today. So I want to explain what the gut-brain axis is. This is a complex with a two-way communication system between the brain and the gastrointestinal tract. So there are signals that are sent back and forth through nerves, through hormones, through immune cells, neurotransmitters. So essentially, it allows the gut to be influenced through mood, cognition, and mental health. So it's not uncommon, like I said, when people show up in my clinic and they tell me they have depression or anxiety, that it's also coupled with some digestive issues. And so, or vice versa, someone comes in with a lot of digestive issues, and on top of that, they're feeling down, depressed, low energy, cognitive dysfunction. And these two systems work hand in hand together. So I want to talk about this nerve. It's called the vagus nerve, and it's one of 12 cranial nerves that are in the brain. And it's one of the longest nerves. I know there's a lot of talk about what the vagus nerve is. But the reason I talk about the vagus nerve and the importance of it is because as it leaves the head, the cranial head, it is innervating all the way down through the neck, into the heart, and into the digestive system. So this nerve helps to regulate parasympathetic states. We need to be in a parasympathetic state, meaning relaxed. Okay, you need to be relaxed when you're getting ready to digest. And so one of the things that I always explain to patients is make sure that when you are going to sit down to eat, that you're calm, there's not a lot of noise, that you're not angry, upset, so that you're able to pay attention to your food, chew well, and digest it well as well. Usually when people are eating on the go, you're not in a calm state, so you're not going to be able to break down food, absorb everything well. So a lot of primary care doctors usually don't address gut issues. They'll refer to a GI doctor, right? Let them take care of it. And the GI doctor will do, some exams. They'll either do endoscopy, which is an examination from the mouth, looking into the upper part of the digestive system. A colonoscopy looks at the colon. There's imaging that can be done. There's not a whole lot of other testing that, some doctors might do unless there's something special, a specialty that they're wanting to go after and find if there's an issue there. But some of the tests that we do, that I do in office, takes a look further into the digestive system. They're looking at the gut diversity of the digestive system, called the microbiome. So I want to talk a little bit about this gut microbiome. It's a living microorganism that's living in your intestines, and it's made up of about 200 different species that are made up of bacteria and viruses and sometimes fungi in the digestive tract. And some are harmful to our health and some are not. Some are actually necessary. So we have good bacteria everywhere in our body, especially in our gut. I refer to these as little workers that are working together to help build hormones and neurotransmitters and other things in the body. So what can affect your gut microbiome is going to be high levels of stress. So we know that cortisol will start to break up, destroy the inner lining of the digestive system, right? That protects from anything bad being leaked into the body. lack of sleep and quality sleep. And the reason sleep is so important as it relates to our digestive system is that during the time that we sleep, our body is healing and repairing, and many different processes are occurring during that time that we sleep. Eating high processed and sugary foods are always going to cause a lot of inflammation, and it's just going to be harmful to the digestive system, specifically the small intestine, right? And then there are some medications like antibiotics. If you have overuse of antibiotics in your life, it will cause harm to your healthy gut microbiome, right? The good bacteria will get wiped off as well. Some of the contributing factors to a poor gut microbiome that can affect our health in such a way is, so if we have an unhealthy gut microbiome, it's going to affect our immune function, because a lot of our immune system function comes from our digestive tract. It's going to affect our hormone levels, weight, it will develop disease, and it will result in some brain health issues. So what are the 7 signs of an unhealthy gut? So some people say they have an upset stomach. So what does that look like? So is there gas? Is there bloating, constipation, diarrhea, heartburn? Those are some things that might, cause some tummy pain. That could be a sign. If you have diarrhea constantly or constipation constantly, bloating after you eat certain foods, there's something off in your gut that that needs to be addressed. The second thing that could contribute to an unhealthy gut is, once again, it's that high sugar diet. It just causes a lot of inflammation, and it starts to destroy the cells there. If you start to see, if you have unintentional weight changes, so if you lose weight too fast or gain weight rapidly, these are signs that something's wrong with your gut health. And I have seen this where, someone's losing weight and they're not trying to lose weight. They don't need to lose weight. And there's a lot of bloating and diarrhea. And immediately when I hear that, I think parasites. And we're going to talk about that later on. So if you're unintentionally losing weight, there might be parasites there. You might want to take a look at that. Signs of an unhealthy gut, it's going to be if your sleep is off, so you're having sleep disturbances, or you're constantly fatigued. If you have skin irritation. So sometimes skin issues are actually a gut issue. I know people want to put all the topical lotions and different treatments on the skin, but I always tell people who come in with skin irritation, like eczema or any kind of dermatitis, like, you need to take a look at the gut. Even if you have acne, cystic acne, you want to look at the gut. And a lot of people ask me, Anna, what do you do on your skin? It looks good. I'm like, I don't do a whole lot to my skin. It's what I'm eating. What you eat is going to contribute to skin health. So you need to make sure you have a good, healthy gut. If you have autoimmune conditions, this is linked to unhealthy gut issues. So you always want to make sure that you're cleaning up the diet and you're giving things to your body that's going to help to heal and repair the digestive system. And this is one of the key things with autoimmune conditions that I see is people are running after the symptoms, the fatigue or the joint pain or whatever is going on, hair loss maybe, but they're not addressing the deeper root of it, which is the gut health. You got to help to heal the gut. Sometimes, if you have food intolerances, this could be a sign that you have an unhealthy gut. So there's a lot of tests that, check for food intolerances, and they're great. But sometimes it's not the food that's causing the problem. It could be that your gut is just off. And I joke around with my patients, but I'm serious when I say that if you are under high chronic levels of stress, it is going to affect your gut health. And so it's the equivalent of eating the cheeseburger and fries and the Coke. It will cause an inflammatory, destructive reaction in the gut. So some of the common things that I see digestive-wise in my practice, especially as it relates to mental health, when someone comes in and they are telling me they need help with depression or anxiety, I'm doing a full, thorough assessment of what's going on with them. What is their bowel? How often are they having a bowel movement? Are they having any bloating or gassing, diarrhea, constipation, any abdominal pain? How are they sleeping? Are they able to fall asleep well? What is their stress level like? Are they exercising or not? And so when I do an evaluation of blood work, I'm looking at vitamin D levels and and other inflammatory markers and hormones and thyroid health. I rule out everything to see if this person's condition, right, the depression or the anxiety, if it's a psychological thing, is it a personal, like something in their personal life relationship that might be causing them to be depressed, or is there something physical and physiological that's contributing to their symptoms? Remember, depression and anxiety, they don't just show up. There's something that led the person to get to this point. And if your gut is not healthy, then it can contribute to mental health issues. And on the flip side, if your social life, if there's something socially in relationships that are going on that is really disturbing your peace and is constantly putting you under stress, it is going to be destructive to the rest of your body, especially your gut health. So it's like, what came first, the chicken or the egg? And we have to dig deep down and find out what that individual person is going through. So if you are having digestive issues, you might want to start to assess, when did this first start in my life and what was going on at that time in my life? So sometimes people will say, I've been having digestive issues since I was 8 years old. Well, what was going on in your life around that time or leading up to that time? And so they go back into this journey and they start to see and assess that there was a lot more than that they were not paying attention to or were aware of that led them to this point. There were maybe some trauma that happened that after that point, they started having gut issues. Children are so sensitive to stress. This is how I tell parents that I know that if your child's digestive issues is not because of their diet, there's something that happened. If it's not something that happened at home, it might be something that happened at school, something that was traumatic or a stressor that they're experiencing. And so these are sometimes, this is one of the ways that we know if a child has been abused is because they will start to have digestive issues. Even if it's just my tummy hurts. They don't have the words, they don't have the vocabulary to explain how they feel, their symptoms, but it's showing up. So other things that I see in my practice, very common with digestive issues, is people with autoimmune conditions. So this is why with all people, regardless of what they're coming in for, we start to look at the diet. What are they eating? What are the foods that they are reacting to? Start eliminating the foods that are problematic, the high inflammatory foods. I did a whole episode on that, on foods that are, high inflammatory that you should avoid. And so we start to do that. We start to eliminate these foods and start eating the foods that are helpful and start giving the body what it needs so that the gut health isn't compromised. But other things, cancer as well, we got to make sure that their gut health is optimal. And it's very difficult when people have cancer and they're doing the chemo and the radiation, because these medications oftentimes leave them nauseated and they're vomiting. And so they just have no desire to eat. But we still have to encourage them to eat in small amounts and eat the right foods to still, help their gut health. Constipation and diarrhea are very common digestive issues that I see in my practice. Sometimes I get people that have had ongoing diarrhea for years, and they've gone to the primary care, they've gone to digestive doctors, the GI doctors, and everything's normal, right? But this is where I want to talk about the type of test that I do. It's called the gut zoomer test. And there are other specialty tests that are similar to this, but these tests are looking at gut diversity, so the good bacteria. And it's the good bacteria that impacts everything in our body: hormones, heart health, autoimmune conditions, and so forth. It has digestive inflammatory markers. So we want to know where in the digestive tract is there some inflammation? Is there some compromise there? We're looking at digestive insufficiency and malabsorption. So is this person digesting and absorbing fats in foods, carbohydrates, and proteins well? So this is a stool test. The patient collects it at home and sends it into the lab. And through the stool, the lab is able to assess if they're digesting proteins and carbs and fats well. And if they're not digesting it well, then we know they're not absorbing it because it's leaving through the feces. And so it's also able to let us know if they need enzymes to help break down these foods, or what else can we give them to support them in digesting foods. Because if you are not able to break down the food right, and the intestines are not able to absorb it, then you're nutrient deficient. And this is where I find that people who supplement with vitamin D and they're still low is because they have a gut issue. So the absorption is happening in the gut, the activation is happening in the kidneys, and the liver has a whole process in that too. So I want you to understand that the liver, the pancreas, the kidneys, the small, large intestine, the stomach, the esophagus, from mouth to the end, those are all part of the digestive system. So we are assessing that full system and what's going on. This test will also let me know if there's intestinal permeability. And what that means is there anything leaking the gut that should not be leaving the gut? And where does it leak into? Great question. It's leaking into your bloodstream. And this is why someone who has a leaky gut is going to have food sensitivities. So doing the food sensitivity test doesn't make so much sense. It makes more sense to do a gut test like this, that it's going to let me know if that person has leaky gut. Most likely that's going to explain why they have so many food sensitivities, even to the foods that are healthy. I've had people that are sensitive to broccoli, carrots, just the random things that are healthy and good for you. They shouldn't be sensitive to those foods. So if you're sensitive to gluten, it could be it is a gut issue. This test also looks for pathogens. So we have good bacteria, but this looks for the bad bacteria. It looks at viruses and fungus and parasites. And you know what? I have seen it all. I have seen people come in and there's bacteria in their stool. So we need to get rid of that bacteria overgrowth that they have. If there's a live virus that is impacting them, that's showing up in the stool, it's not just the blood, it's showing up in the stool, then we know this person either has a chronic exposure to a virus that's active, or they recently were exposed to something that's affecting them still. And parasites is something that I'm sure many of you keep hearing on social media and podcasts about parasites. And some doctors have gone to the extreme of saying everybody has parasites. And I wouldn't assume that you have a parasite and then you start doing parasite detoxes, because the fact is that there's different types of parasites, and each parasite is detoxed differently as well. So I do see this as one of those cases where if someone comes in with chronic ongoing diarrhea, I'm going to do this test, and 9 out of 10 times there is a parasite present. And so then there's natural ways that we would go about detoxing that person. If it's a parasite that's pretty in-depth, that's pretty extensive, then I might use medication for that. It just depends on the person what they're wanting to do also. So these tests can be very helpful, because it also lets us know, as part of looking at the gut diversity, the good bacteria, if it has different categories, and one of those is on mental health. So if the good bacteria that contributes to our cognitive and mental capacity is, that bacteria is low or too high, then we know which types of probiotics we need to give to the person. And then there are different types of probiotics, and they all do different things in the body. So we want to make sure that we know what good bacteria is present, what's high, what's low. And so if you're having issues with either of these, two or both, there's most likely a connection, and even a little bit further, because we know how trauma and stress, what they do on our body. Usually people with trauma have these issues. They have gut issues, and there's, cognitive or depression and anxiety issues. So just wanted to touch a little bit on the gut-brain connection and some of the things that your doctor is not going to do. Just know that there are extensive gut microbiome tests that you can do that are very helpful to fully assess your gut health. And if you're interested in learning more about these tests and how I can potentially help you, feel free to reach out, visit my website, and schedule a free 15-minute phone consultation to see, as it relates to you, particularly to you, how this might be affecting you. So until next time, guys, be blessed. Thank you for listening to Physician Heal Thyself, the podcast. If you like what you've heard, please like, share, and subscribe. Help this message reach more people who may need to hear it. Leave your comments. I want to know what you think. If you're interested in learning more about Raices, visit our website at raicesndmedcenter.com. Until next time, be blessed.